Hey, Endo Warriors, thanks for joining us again. Today we're going to do something a little different, and together we're going to watch clips from the documentary Endo What. It's a documentary that helps to share the importance of endometriosis, of why it's important to know about it, and to not just leave it alone, and that we need more doctors. And it helps to bring awareness from the patient's perspective as well as from the doctors. We only will be showing clips of it, but if you do want to watch the whole thing, we will post a link below as to where you can find it. Well, let's get into it.
Now, it's not only painful, but it's also a common cause of infertility, yet a lot of women don't even know they have it.
Endometriosis.
Endometriosis is a common ailment affecting as many as 1 in 10 women.
Endometriosis is a painful, debilitating disorder that affects nearly 200 million women and girls.
Frustrates doctors and patients alike because it often goes misdiagnosed. Meet one woman who struggled 10 years to find the cause.
I knew something was weird. I knew something was wrong, and I needed a doctor to confirm what was going on.
I got to the point to where I just asked God to take me.
It's ruined friendships. It's ruined relationships. It makes me moody. It makes me angry. It makes me feel sorry for myself. And I try to keep that all inside, but sometimes it's too much.
I remember a doctor asked me if my mental health was okay, because it's like an invisible pain. They do CAT scans, they do all these exams, and they can't find it, but I'm still complaining.
You become a silent sufferer. You stop expressing your pain because you're being told your pain is normal.
Because endometriosis is such a complex disease with so many different components affecting it, all these different things affect different people in different ways.
Endometriosis is like a big puzzle. We have many small pieces of puzzles. And those puzzles seems to be validated. They all have something there, can support it, but they cannot explain the whole picture.
Endometriosis actually is a systemic disease, and by treating the spots, you're not getting to the source of the problem.
We clearly know there's a genetic component. The women whose mother or sister has endometriosis are about 7-fold increased risk of having it themselves. We're trying to get at the molecular basis of endometriosis. Where does it come from? One thing that's troubled us for many years is sometimes we find endometriosis in very remote places, in the lungs or the brain. There were even years ago reports of endometriosis in men. These were men being given high doses of estrogen for the treatment of prostate cancer.
So the ASRM classification does divide endometriosis patients into 4 groups, simply labeled 1, 2, 3, and 4. 4 being the most severe. While it's generally true that the more disease, the more pain, and the greater number of surgeries that you tend to run into at a given patient, there is no particular lineage of pain correlation with observable disease. There are perhaps as many as 1 in 10, 2 in 10 patients who have stage 4 disease and no pain.
It's inspiring how many doctors and advocates are out there pushing for awareness, but at the same time, it's a reminder that it shouldn't be this hard and how unfair it is, and that we need to stick together more than ever to keep pushing for better healthcare for all, for equality for all, and hopefully the next generation will have it better than what we have had.
Oh gosh. I've seen probably at least 6 doctors.
I've heard everything. The first time I went to the emergency room, they told me I was allergic to milk. They've told me to go see a psychiatrist. They told me it was all in my head.
A lot of times they just didn't know. It was just, this is what happens with girls and women, and you're just gonna have to take pain meds and move on.
Mostly what I heard was that painful periods are normal and it's nothing to worry about.
They thought I was a drug seeker at one time because I would constantly come in with pain.
There's this incredible experience of going to all these different doctors and feeling like you're the problem. It's got to be in your head, and there's all of that going on. So you want to find someone to help you, but the problem is who? Very few people honestly know what they're doing with this disease.
The issue that has always been underlying all of this, oh my God, is it in her head or is it real? Well, it's always both, because there's an emotional reaction to the pain and the frustration of not being able to find somebody who at least listens and helps find resources.
Lots of women suffer and think that it's supposed to be that way. And then they ask someone that's trusted, a family member, who says, you know, I suffered, your grandmother suffered, it was sort of the curse of our family, or lots of people suffer. So we don't have a relative idea of what's normal.
Women are taught for millennium that when you have your period, that is normal, pain is normal, that is part of the womanhood. Pain is not normal.
I went 18 years thinking that this pain all the time was totally normal.
20 plus years.
More than 15 years?
20 plus years.
22 years.
13 years.
6 years.
13 years.
12 years.
10 years.
13.
6 years.
13 years.
I probably saw about 10 doctors for my symptoms, maybe more. It's hard to keep track.
I think that sometimes, maybe doctors will get a diagnosis in their head and they'll stick with that and won't look beyond that.
So I'm sure you hearken back to the times that you were in physicians' offices and you were telling your story and nobody listened. Like they were listening, like nodding their head and yesing you. To be honest with you, as a clinician, half of the problem that we run into when we see patients who may have this condition is we don't give them enough time to share their story, we don't listen, and we don't communicate effectively. I tell you, one thing I learned when I was a fellow is 90% of the time, it's the history and the physical alone that will help lead you to the diagnosis.
I bounce from doctor to doctor. They do, whole lab panels, blood work, they do imaging, and then they would tell me I was fine. I was told it was in my head. I was told I just needed to learn how to deal with it. I was told that I would get used to it someday, but no one ever could tell me what was wrong. I started to think that it was me. I just couldn't handle, being female.
Diagnosis of endometriosis is difficult, and it's difficult for a lot of reasons. Scanning and diagnostic studies, laboratory work, none of that provides the ability to rule out endometriosis. The true symptomatic profile isn't well known, isn't well taught. Many people do not seem to be aware that endometriosis can cause severe bowel dysfunction. People get nauseated, they get diarrhea, they get constipation, they get severe bloating, they get pain with bowel movements, they get pain with sex, they get pain with a full bladder. All of those things kind of get set aside.
The associated conditions typically include irritable bowel syndrome, interstitial cystitis, pelvic floor muscular dysfunction, thyroid problems, chronic fatigue, There's a gastritis, all the different itises, all the different inflammation.
And then there's a lot of just systemic or overall symptoms, you know, the fatigue, the kind of fibromyalgia, almost like symptoms, joint pain, just feeling sick or like there's just some kind of poison in the body.
For me, the pain is like, it feels like somebody's cutting my thigh off or at my hip with like a dull blade, and they just saw it off repeatedly over and over again.
It's not that you can just take Tylenol, it goes away.
Crippling pain.
Things you're not really supposed to even think about that you're doing would stop me and fold me over in pain.
I would have hot flashes, I would have chills, I would have rectal bleeding.
Migraines, fatigue.
It was difficult to walk, it was difficult to sit up.
It just feels like someone is taking a roller and rolling up my insides, and it's tighter and tighter, and then rubbing barbed wire through it.
I kept hearing, condescending remarks of what you have isn't a big deal. It's just cramps, or, have you thought that maybe you're bipolar, or maybe you're a hypochondriac? And it just killed me.
Family members that are not very supportive. You lose a lot of friends because you can't keep up physically with them.
Living through the pain, I sometimes can deal with, but it's really hard to deal with the aftermath of the pain, the way I reacted to the pain in my life and my situation. So I think that's a really hard thing to deal with.
Stress is a big factor. What happens when you're under a lot of stress? The body produces stress hormones, cortisol. When the cortisol rises, it also increases the cytokines, which is an inflammatory protein that causes inflammation. So stress has a direct correlation to inflammation.
So you think about how you feel emotionally when you're in pain, and how can you separate that? The more stress you're under, the more tension you feel in your body, and the more tension you feel in your body, the more pain you feel in your body, and it's really hard to unwind that once it gets caught in that spiral.
While stress plays a role, there's a difference between stress plays a role and stress is causing this. And I can see so many women are told it's stress and it's really disease that needs to be better managed.
We went to the gynecologist, and of course, I'm 16, I'm terrified. And they said, you have a normal period, everything's fine. We're gonna put you on Yasmin, and it'll help your symptoms decrease. And so I thought that, I believed that. A doctor telling me this, it has to be true. And then it became pretty evident that it wasn't true.
We do see young teens with endo. So is that crazy or does it make sense? Well, if you think about it, it's an estrogen-dependent disease. When does estrogen start in a woman's body? As she starts to develop breasts. That's when the symptoms may start. So it may start even before she has her first period. The pain is different sometimes in adolescent women versus adult women. And that can be tricky for primary care providers, for gynecologists, nurse practitioners, in that they may have been trained to look for endometriosis with pain with periods. But for an adolescent woman, she may have pain in between her periods, pain with her periods, or pain every day of the week. I usually suggest that women think about, can they do their best? Or are they disadvantaged by their symptoms? If they're disadvantaged, that's not normal. They shouldn't be missing school. They shouldn't be in pain to the point where they're cranky or don't want to participate socially in what's going on in their lives. That's when we need to listen to them and move forward.
When you're just starting out and you're going through teenageness, which is a very difficult time, your hormones are going up and down. You're trying to define who you are as a person. If you're looking at your peers very carefully, they're looking at you very carefully. You don't want to stand out in a negative way, and yet here you have this pain, this thing that's stopping you. You're feeling older than your young years.
I think it's hard to have a chronic disease, no matter how old you are. But if you're a teenager and you have a chronic disease that involves your female reproductive tract And most kids your age, if you're a 12 or 13-year-old, feel uncomfortable talking about reproductive issues, makes it a difficult situation.
What I try to tell parents of teenagers is the most important thing you can do is be there emotionally for your daughter. Meanwhile, start reading everything and, question. Sit in front of the computer and look at some of the things online and question with her.
I do see 15, 16, 17-year-olds who come from other healthcare providers who are frustrated, and the families are frustrated, and they're told they need a hysterectomy. I think that's criminal. I do not think we should be removing the reproductive tract of young women, or any woman, until she herself has decided she has completed childbearing.
If there's estrogen and the peritoneum with the disease is left, hysterectomy will not help. Removing the ovaries will not help if you leave the disease behind.
There may be up to 20% of those women that have recurrent endometriosis even after they've had their uterus and ovaries removed. And specifically those women who are treated with estrogen after they've had their hysterectomy may have recurrent endometriosis, perhaps as high as 40% who are treated with estrogen.
The medical treatments of endometriosis are really based on hormone manipulation. And the strategy is either to reduce estrogen or increase the ratio of progesterone to estrogen or push them both down. Usually the first line is birth control pills, as it steadies out the hormones. You can eliminate the periods often for months at a time, and that may, temporarily at least, take care of the symptoms, and the side effects for most but not all women are amenable.
Because estrogen is a hormone that drives the inflammatory response and the progression of endometriosis, and progesterone is like the dampening hormone and kind of suppresses the further development of endometriosis.
The next steps are kind of a big jump. We look at things like Lupron, which basically alters the brain chemistry to turn the ovaries off. The Lupron temporarily suppresses, if it does suppress, the endometriosis. So it's like your lawn in the wintertime. It doesn't look too good, but you give a little water and some sunshine and it's back. It's like any other treatment. You really need to understand the pros and the cons, and the plus column needs to outweigh the minus column, and unfortunately it seems like for a lot of these patients it doesn't.
When I was on Lupron alone, it was a 6-month course, and I didn't know what was going on. My doctor just told me that I would have hot flashes, and that was not the case. That was bad. That was very, very bad. And I bet I saw 8 doctors just in that 6 months of, oh my gosh, this is crazy. I just came in for pain, and now I have joint inflammation. I have night sweats that were just unbelievable, mood swings that were horrible. I can't believe I didn't get fired a couple times with some of the things that I did, or some of the things that I did that I could have gotten arrested for.
Endometriosis surgery has loaded with complications. It's more complex and riskier, 7 to 8 times riskier than any other surgery, because it involves multiple organs. 1/5 of the time bowel is involved. Almost always pelvic side walls are involved. So it cannot be done by regular gynecologists as a routine surgery. And I can underline this. It cannot be done by doctors who are delivering babies till 4 o'clock in the morning and scrubbing at 8 o'clock to going to an endometriosis surgery.
The problem lies in so many people don't know that endometriosis can have so many different appearances. So there's so many laparoscopists, or gynecologists rather, around the country, around the world, who take a patient to the operating room because they have pain. But they don't know the different appearances. It can be blue, it can be black, it can appear yellow, it can be fibrotic. We can't just put a laparoscope in, take a look at a lesion and say, oh, that woman has endometriosis. The only way to make the diagnosis of endometriosis is by removing the endometriosis, sending it off to pathology, having the pathologist look at it under the microscope, and confirming that the endometriosis or that lesion has endometrial glands and stroma. We certainly need someone to cut out endometriosis. Excision of endometriosis really yields much better relief for those women because you're removing the endometriosis. If you leave endometriosis behind, you're leaving something foreign in the female pelvis that's just going to continue to cause pain or even worse, cause adhesions. How one does it, whether they use scissors or a laser, the tool doesn't make the difference. It's whether the surgeon is excising it or just burning the surface of it.
So this is the key of endometriosis surgery. When you remove or destroy a tissue with energy, you leave a burned tissue behind. That burned tissue, at times it has still residual endo in it, but more of it, you leave a fibrotic scar tissue behind. That was the soul of endometriosis itself.
Endometriosis shouldn't be the path of 15 surgeries. It should be one surgery done right.
Sadly, many of us have been told that it's in our heads, or we're making it up, or we're trying to get attention, or that we're seeking drugs. I remember having endometriosis myself on my appendix, and after being ignored many times and misdiagnosed, I went into the family doctor in tears because I couldn't take the pain anymore, and I was asked if I was feeling depressed, instead of them actually looking into what was wrong. And of course, when you're in pain, you're not happy. But the problem that needs fixing isn't a mental issue at that moment. It was a physical. And this happens to so many of us. And it's amazing how wild this is, that it affects 1 in 10 people assigned female at birth, and yet it flies under the radar so many times. You might want to have a tissue with you for the rest of the film because it does get pretty emotional. Just a little warning.
Excuse me, it's just, I get emotional, but it's really bad, especially when you want to have children and you can't have kids. And endo robs you of wanting to have a child.
That's hard to hear at 13, considering you're still a kid and you always have dreams of having kids and getting married and having the white picket fence and happily ever after.
In my group of patients that I'm working with, I frankly encourage all of them to get their endo excised before they enter fertility treatments. The reason for that is I've seen many spontaneous pregnancies occur once the disease is done. They don't even need the infertility work.
There's lots of things that guide patients' decisions as far as what's the optimal fertility treatment. And it's not always just the treatment that's going to give us the best chance of success, because emotionally, there's a lot of considerations to make. Fertility treatment takes a lot of time. Cost plays a role. So everyone's coming from a different perspective.
Even after surgery, you still have the disease, and you got to know the disease well. You got to know your own enemy in order to manage it.
The non-surgical part of endometriosis really is dealing with restoring health. The surgical part can remove disease, but lack of disease does not equate health. And again, this is an area where Western medicine just comes short.
Patients need physical therapy after quality surgery for endometriosis because even though the disease has been cut away, all the other surrounding pain generators are still there. And so if your pelvic floor has been spasmed for, say, 6 to 10 years because of diagnostic delay, it's still going to be in spasm even after we remove the disease.
By getting rid of the trigger points, by calming down the nerves, that is what calms down the pain. It calms down the pain pathways. If a nerve is restricted or muscles or tissues are restricted or even an organ's restricted, it can send messages to the brain that there's pain. So what the physical therapy does is it helps release the tension in the muscle, the restrictions. It helps the nerves glide better. So that in itself can help decrease pain.
Women that I see with endo, with chronic fatigue, fibromyalgia, irritable bowel, all of these things, they all have the same fundamental issue, which is inflammation.
It's a inflammatory disease. If you look at it from that perspective, it's inflammation and it's awful.
So addressing the inflammation is really important, and how we address that inflammation is variable. There's nutritional approaches, there's herbal approaches, there's exercise, there's mind-body aspects of just calming the mind down.
It's multifactorial. So you just can't do one and expect things to work. And in fact, you might try one and nothing happens, but it's happening inside your body. You just can't recognize it.
In terms of treating endometriosis with Chinese medicine, it is definitely okay and often recommended to combine it with Western medical treatment. And the nice thing is that Western medicine and Chinese medicine are coming at the problem from such different angles. They actually complement each other really well.
The goal is the same. We're trying to get the body back to health and optimum functioning. And the body's capable of doing that. And what we're doing is we're basically supporting this restoration process. We're not doing it for the body. We're supporting the natural, healthy normalization process.
The goal is whatever will return a woman to function. You have to figure out what the trigger is for your endometriosis. People ask me, can I still do sports? Can I not do sports? I've had patients with endometriosis teens who have been Olympic athletes. I have others who find that their pain gets worse with physical activities. I don't think we can generalize, but I think we all need to find out what works. Is it heat? Is it relaxation? Is it acupuncture? Is it just taking an hour and smelling something that's pleasant and having a massage? Everybody responds differently. The goal is to make you functional.
Let's start with sleep. Sleep is often just forgotten, and it's really number one, because if you're not getting sleep, you're not going to feel well. Number two, actually, is cleaning up the digestive system. You're not going to be able to absorb nutrients unless your intestine is working.
No one is going to know your body inside and out as much as you do. Ultimately, the highest level of wisdom comes from inside your body. You are the expert.
Be persistent. Educate yourself as much as you can about the disease. I had myself 5 surgeries that were ineffective with a surgeon who wasn't treating the disease properly before I got to the right surgeon. But once I got to the right surgeon, my disease was managed much, much better.
So many doctors just want to calm the symptoms down and not treat the problem. And even though there are only a few of them, there are excision specialists who can help you and can get you pain-free. I had surgery 4 days ago, and I feel better than I have in years because I found the right doctor.
It does get better. You will get to a point in your life where you'll feel you have learned something from the experience. And you are learning something. You're getting tough. You're getting really tough so that you'll be able to deal with other things that come down the pike.
I don't think that women give themselves enough credit in knowing that they are in charge of their own physique, they know their own body, and they know it well, and nobody can tell them different. I think that we have a tendency as women really to subvert our pain and put everybody else ahead of us. Fight it like it was for someone else's battle. Fight it like it was your kid's battle. Fight it like it was your parents' battle. Fight it like it was your best friend's battle. Because if you're not well, you can't be good to anybody around you.
Speaking up about the disease matters. Diseases that get a lot of attention, a lot of publicity, where Congress knows about them, tend to get more funding, more help, faster relief.
Endometriosis puts a burden on society of an estimated $119 billion annually in associated lost productivity, associated care, hospitalization costs. So this isn't just a disease of women with painful periods, this is a societal disease.
There are a lot of women who don't see a way out, and they just, live with tremendous sadness and discouragement, and that's really unnecessary. Women need to be empowered, and they need to be empowered with knowledge and information, and know that you don't have to live with it. There are more that you can do than just accept what the doctor says. Live with it. Just live with it. And I like to tell those doctors, how about you live with it?
Until the group that is affected stands up and says, enough already, it will not stop.
Give yourself a break. Appreciate that really the vast majority of the time, you're right, you're just in a bad situation.
Don't accept what 1 or 2 or 10 doctors tell you is normal when you know that something is wrong.
Do as much as you can to learn about your symptoms, learn about possible treatments.
Get second opinions or third opinions or fourth opinions.
Keep pushing until you find the right provider. They are out there. Find a place that understands you and will listen to you and where you feel supported.
Listen to yourself, fight for what you need to get, and there is hope. There is life after endometriosis. It is possible.
Hi, I hope everyone enjoyed the film. Please leave a comment and let us know what you thought. We'll also leave a link below to the website where you can order it and watch the whole thing in full. I hope everyone enjoyed it again, and please like and subscribe to our channel. Have a great day.